Hello. Today we're going to talk about cleft lip and palate, which is one of the most common congenital anomalies in children. Every 1 in 700 births is going to have it. My name is Dr. S.C. Sood. I'm Principal Consultant of Plastic Surgery at Max Hospital, Shalimar Bagh, and cleft lip and palate is a passion with me. When a child develops in the womb, face forms from 3 segments. There is a central segment, which will form the nose and the middle part of the lip, and 2 segments from the sides, which will form sides of the lip. When all these 3 segments or one of them fails to fuse with the rest, that leads to cleft lip. These segments fuse and also give shape to the roof of the mouth, or the partition between the nose and the oral cavity. So when the fusion is incomplete throughout the length, then there is a gap in the roof of the mouth also, and the nasal cavity connects with the oral cavity straight away. Roughly 1 in 700 children will be born with this defect. This is a severe facial deformity. Not only that, there are many other issues also which are attached to this. The child fails to feed normally. These children are nutritionally deficient, they fail to grow. And there are major issues with their dentition and with speech. But the good news is that if we provide treatment to these children at an early stage and do it throughout their life as and when required, most of these kids will be absolutely normal. So when they walk on the road and you meet them, maybe you'll notice a little bit of a scar on the lip. Other than that, there'll be nothing else. The treatment of these children needs to start the moment they're born. Our first important thing we need to do is that a specialist needs to see this child and educate the mother how to feed this child. Feeding and nutrition is very important because at this age, kids grow very fast. And growth is important because the healthier kid is a fit kid for surgery and further treatment. At 3 months of age, we do the first surgery. For the first surgery to be done, we need the child to be at least 5.5 kgs of weight and healthy and free of any infections, especially chest infections. At 7 to 9 months of age, we do the palate repair. It's important that we do it at this repair because palate repair is responsible for speech. And it's a year and a half kind of an age where the child starts to babble. Now, babbling is the first step to learn how to speak. And at 1.5 or 2 years of age, you'll see the child speaking. So we need to do the palate repair at the right time to speech to be normal. Some of these kids, in spite of good palate repair, may have some speech issues. These kids are identified at the age of 3 and 4 years of age, or earliest whenever they can sit and talk to us. These kids then go for speech evaluations, speech therapy, and at times they require further surgical procedures to improve speech. At 5 years, we do what we call as preschool surgeries. These surgeries are done to make it sure that when the child goes to school and interacts with other children, he looks as normal as it's possible. At 9.5 years of age, we start dental treatment. That's when the permanent dentition comes. And at 15 to 17 years of age, we do final retouch procedures. Very often people ask me what causes a cleft. There is no definitive answer we have. Is it because of nutritional deficiencies? Is it because of smoking or liquor consumption or alcohol consumptions in mothers, which practically is very less in our society? Or it's something else. Like traditionally, people in India have believed that when a pregnant lady goes out in eclipse, that is the reason why she gets a cleft. That's certainly not true. The exact cause we still are not aware of. But yes, a good diet and nutrition to the mother is absolutely essential. And it's essential that smoking and other things which promote congenital anomalies are also avoided. There is a small incidence of inheritance where parents who have cleft will also be with children who also have cleft. The incidence is roughly 2%. So 98% of these people will give birth to normal children. Also, there is a small incidence where these children are associated with other congenital anomalies, like anomalies of the heart, of urinary system, or of hand and feet, or other facial anomalies, anomalies of ear or skull. These children need to be identified, and other anomalies also need to be taken care of. These kids need to be identified early so that we can manage these heart problems or other problems simultaneously with management of cleft lip and palate. As you're listening to what I'm saying, you must be thinking that this is a very long and cumbersome thing. It's not. You will require regular visits to the hospital, but all procedures are separated by 3 to 4 years of gap. And it's important that all these treatments are done at the right age. One good news is that as cosmetic surgery has progressed so much in the world and so many people go for facial aesthetic surgery, all those concepts are being incorporated and applied to children with cleft lip and palate. So they can have an aesthetic nasal correction, they can have a aesthetic lip correction, they can have a lip augmentation if the lip is thin. They can have, like children can have in fact grown-up men now, can have hair transplant into the scars to hide or camouflage this scar. So many other things are possible at 15 to 16 or 17 years of age that we can hide and cover up for all the residual anomalies which persist into the adulthood. Finally, when all things are done and this person walks on the road, best anybody can say is that maybe there is a little bit of scar on the lip and maybe the kid has fallen and got it. Nobody can identify this kid as a kid who's congenitally abnormal. So it's time that as a society, we accept these children as normal, productive individuals in our society and help them with their problems which have definitive solutions so that these people, they succeed in life and live their destiny to the fullest. Thank you.